Treatment notes. Objective measures of language style point to clinical insights. Part 1. Application of a computerized text analysis procedure is proposed that has the potential for use by psychoanalytic and psychodynamic clinicians. The systematic examination of linguistic style as reflected by clinicians in their ongoing process and case notes, which are ubiquitous in the mental health field. The studies reported here are, as far as is known, the first attempts to study treatment notes systematically using such procedures. Linguistic measures are used to track the trajectory of the clinical process throughout the treatment in two contrasting cases, one rated successful, the other not. The computerized linguistic analysis used here focuses on two analytically relevant linguistic variables. Mean high referential activity, MHW, a measure of the degree to which language is connected to emotional processing, and reflection, REF, the use of words referring to logical functions. Changes in the relative position of these measures indicate nodal points in the treatment that might be analytically or therapeutically problematic and that might be overlooked in a solely clinical reading. The analyst's activity, as reported in notes during such nodal periods, is clinically examined to see how it may have affected the course of the analysis. This method has the potential for use in ongoing treatments and may help clinicians refine their interventions. In many of the healthcare professions, there is a gap between science and practice, and for far too long this gap has been widest in psychoanalysis and psychodynamic psychotherapy. In recent years, increasing attempts have been made to narrow this gap, e.g. Luton, Blatt, and Corvaline 2006, Levy and Ablon 2010, Kashili, Schachter, and Tama 2009, Friedman et al. 2011, Midgley 2012. Yet clinicians and students of clinical psychoanalysis still find it difficult to incorporate research methodology in their clinical work and education. See Schachter and Lubersky in 1998, Werbart 2009, Preter, Algus, and Hoffman 2012. It is essential, then, that psychoanalytic and psychodynamic researchers attempt to demonstrate to clinicians the value of systematic empirical studies for their work with patients and in teaching their students. Over the years, Wilma Bucci and Bernard Maskit have been engaged in a long-term project that tries to integrate systematic linguistic analysis of psychoanalytic and psychotherapy sessions with a clinical evaluation of those sessions. See, e.g., Bucci and Maskit 2007, Bucci, Maskit, and Hoffman 2012. In this, the second in a series of studies, we propose a systematic method with potential for use by psychoanalytic and psychodynamic clinicians. The examination of clinicians' linguistic styles as reflected in their ongoing process and case notes, which are ubiquitous in the mental health field. Ongoing treatment notes. Process notes, or periodic summaries of treatments, written by analysts and dynamic therapists as a treatment progresses constitute the traditional database for psychoanalysis and psychodynamic psychotherapy, for training and supervision, for writing case reports, for confirming an accepted theory or demonstrating the value of an alternative or new one. Wallerstein and Sampson 1971. Tuckett 1993. Michaels 2000. Colombo and Michaels 2007. Glick 2008. Walpert and Fonagy 2009. Colombo and Michaels 2007. Maintain that no other method of studying psychoanalysis can give us this same information, fragmented and distorted as it inevitably is about the psychoanalytic process. p. 640. Glick 2008 stresses that writing can offer access to unconscious aspects of the analyst's experience, defensive behavior, thinking, emotion, values, and attitudes. It makes available for reflection many of the dimensions of lived countertransference, and provides some perspective on the analyst's role in therapeutic process and change as both a transference object and a new object. p. 1228. To our knowledge, our studies are the first attempts to study treatment notes systematically using computerized text analysis procedures developed in the context of a psychological model of the psychoanalytic process. This method can be useful both scientifically and educationally for clinicians and their supervisors and can further the systematic scientific study of the comparative effectiveness of different interventions as implemented in everyday clinical treatment. In a series of studies, we address the question of how notes can be used in a manner that satisfies the clinical needs of students and their teachers while adhering to earned scientific criteria. Aim of the present study. In this exploratory study, we illustrate the potential clinical applicability of a systematic examination of the linguistic measures of ongoing clinical notes by analysts. We note how we can observe in graphic form the trajectory of the linguistic measures through the course of treatment and how the variations in these measures can be used as guides in clinically assessing the ongoing clinical notes. We suggest that variations of the linguistic measures provide a diagram of the clinical course described by the analyst and that these variations can help clinicians recognize potentially critical areas in the treatment, e.g., turning points that we call nodal periods, that may be missed when the material is viewed only from the clinical perspective. To illustrate our proposed method, we will compare the ongoing treatment notes of two cases, one successful and the other not. In both these cases, we show how the language measures pointed to nodal periods in the analytic work. These periods were then examined in depth in an effort to understand why one case progressed to a successful termination, whereas the other ended in a disruption and a forced interruption of the treatment by the analyst. The overall project. In a series of studies, we have systematically examined treatment notes from 14 analyses carried out by psychoanalytic candidates under supervision at the New York Psychoanalytic Society and Institute Treatment Center during the latter half of the 20th century. Because of the great size and unsystematic nature of the collection of case material at the center, devising methods for studying it has been difficult. The development of automated techniques has finally made it possible to begin its systematic study. We describe our use of these techniques in detail in Bucci, Maskit, and Hoffman, 2012. Our initial study. In our initial study, Bucci, Maskit, and Hoffman, 2012, we discussed the scientific problems and pragmatic value of using treatment notes as data and the theoretical and empirical background of Bucci's multiple code theory. In that theory, referential activity, RA, is an empirically derived measure that assesses the degree to which language, verbal symbolic, is connected to the nonverbal elements of emotional processing, nonverbal symbolic and subsymbolic, including the degree to which a person's use of language is connected to his or her emotional experience. This theoretical approach, which has been employed in many clinical and experimental studies, e.g. Bucci 1997, Bucci and Maskit 2007, Nell, Sun, Moskovitz, and Steiner 2008, was applied for the first time to the study of notes written by psychoanalysts by Bucci, Maskit, and Hoffman 2012. In this first study, we described in detail the methods of the study, including selection of cases won from the treatment center archives and confidentiality protection. The selection procedure resulted in a sample of 14 cases over the last 5 decades of the 20th century, including at least one successful and one unsuccessful case from each decade. The selection was made using both ratings by clinicians at the time of treatment and current verification by expert clinicians using the Global Assessment of Functioning Scale of DSM-4, GAF. The scale was applied to beginning and end segments of the treatment notes. The segments were randomized, and raters were blind to the clinical evaluation at time of treatment. In this initial assessment, a GAF level of 61 or better at the close of treatment was set as a minimal cutoff point for positive outcome. For the full assessment, change measures were also included. The 14 cases selected for this study were also evaluated using the Psychodynamic Functioning Scales, PFS, Hoffman et al. 2000, 2006. The PFS is a good measure for judging the outcome of a psychoanalytic treatment because it seems to measure a construct that is discriminable from general symptoms and dysfunction. Hoffman et al. 2000, page 194. The PFS has 6 scales: quality of family relations, quality of friendships, romantic/sexual relationships, tolerance for affects, insight, problem solving, and adaptive capacity. The scales of the PFS, like the GAF, are scored between 0 and 100, with anchors every 10 points, interpreted as meaningful clinical differences. All scales were scored by 3 raters. Reliability was measured as intraclass correlation, ICC, representing level of agreement among all 3 raters. For the PFS scales, ICC of 0.6 or better was achieved for 5 of the 6 scales. Adequate reliability was not achieved for the quality of friendship scale, which therefore was not included in our assessment. ICCs for the PFS range from 0.633 to 0.80 for the other 5 scales, with a mean ICC of 0.699. ICC was 0.874 for the GAF. For this earlier study, a composite measure called the Composite Clinical Evaluation, CC, was computed based on final scores and change scores for the GAF and PFS measures. See Bucci, Maskit, and Hoffman 2012. This procedure followed the approach used by Lubersky et al. 2001 in their evaluation of treatment outcome based on archival transcripts in the Penn Psychoanalytic Treatment Collection. For both GAF and PFS, if the end segment received a score of at least 61, but not greater than 70, 1 point was added to the CC. If the end segment score was at least 71, 2 points were added. Also, for both the GAF and the PFS, if the difference between the end score and the beginning score was positive but less than 10, 1 point was added to the CC. If this difference was 10 or greater, 2 points were added. Thus, each of the 14 treatments received a CCE score between 0 and 8, with 0 representing no clinical improvement and 8 representing considerable improvement. A correlation of 0.733, p equals 0.003, was found between the mean height WRAD, MHW, for WRAD, see below, of the candidate's notes and the CCE as reported by Bucci, Maskit, and Hoffman, 2012. In the final assessment of treatment effectiveness, 3 cases showed an increase, with an endpoint above the clinical criterion of 60 for both assessment measures. 7 cases showed mixed results. What is particularly interesting for the purposes of this clinical study is that 4 cases showed a decline in both GAF and overall PFS ratings from the beginning to the end of treatment to a level below the clinical criteria scores of both measures. GAF end scores range from 45 to 55, with an average decline of 6.25 points. Overall PFS end scores range from 46.4 to 57.4, representing an average decline of 5.6. Here we have 4 patients in treatment for an average of 38.5 months who were not helped and, according to our measures, may have been hurt, at least symptomatically, by the treatments received. Table 1 shows that of the 14 cases in our study, 3 showed considerable improvement, with 2 CCE scores of 8 and 1 of 7. 4 showed moderate improvement, with 2 CCE scores each of 3 and 2. 7 showed essentially no improvement, with 2 CCE scores of 1 and 5 of 0. The rationale for this project is the need to identify what is going amiss in a treatment at a point when it might be possible either to rectify it or to recognize that the patient is engaged in a treatment that is not helping, so that a referral elsewhere can be made. Since treatment notes are available for supervised treatments, we wondered if examination of the notes would allow us to identify such points. In making such assessments, computerized analysis allows us to track the full trajectory of a treatment, either in notes or in transcribed session material. It is important to note that in this project, we're looking at analytic material that has already been collected and archived. It is the kind of material customarily collected in psychoanalytic and psychotherapy centers. The notes reflect the nature of the treatment from the perspective of the analyst. Audio tapes of psychoanalytic sessions, which would allow the analysis of patient speech as well, are generally unavailable. And where they are, they require transcription before computerized linguistic measures can be applied. We also point out that the treatment notes permit examination of the analyst's own experience in a way that is not possible with session tapes and transcripts alone.